and welcome to the NRMN Health Research Talk. I'm Ann Smith. Today we'll be talking with Dr. Mona Fouad. Dr. Fouad is Senior Associate Dean for Diversity and Inclusion at the UAB School of Medicine. She's Professor and Director of the Division of Preventive Medicine and Director of the UAB Minority Health and Health Disparities Research Center. She'll be talking with us today about the social determinants of health and how they impact and relate to health disparities research. Welcome, Dr. Fouad.
Thank you, Anne. So today we're going to talk about health disparities and what's the definition of health disparities and what factors impact health disparities. So health disparities is the difference in the health status of groups of people such as race, ethnicity, immigrant status, sex and gender, sexual orientation, income, and also geography. So from this map of the United States developed by CDC, we can see that there are a large number of people that live in poverty in the South. Also, in the South of the United States, there are more than 50% of African Americans and a large increasing Hispanic population.
And the darker colors are the greater percentages.
The darker colors are the greater percentage of the African American population. Also, obesity rates are higher in the South. Heart disease death rates are higher in the South of the United States, and also stroke death rates. Also, we have higher stroke death rate in the South than other parts of the country. So as we can see, the South experiences some of the highest rates of health disparities. The South is the home of disproportionately high rates of poverty, the high concentration of African Americans, and also higher rates of obesity and death rates of heart disease and stroke, and also other chronic diseases.
So now that we see that there are more burden of disease in the South, what are some of the causes of health disparities?
So health disparities is not due to one cause. There are several determinants of health disparities. 50% of these determinants are due to behavioral lifestyles of individuals, 20% due to social and economic factors, and 10% due to healthcare system and access to healthcare. And only 20% are due to biological factors. So for example, the 10% of the variation of health status due to healthcare is not that much, but the dramatic improvement in health over the past 200 years have been due to changes in economic and social conditions. For example, from this study that was done in England, the drop in the infant mortality rates were not due to advancement in health care. It was just due to have cleaner water and the recommendations of washing hands. So most health problems actually occur before individuals get to their healthcare provider. So other healthcare related factors that can impact health disparities are health insurance, if people have health insurance or not, healthcare utilization, especially like preventive care, quality of care the person receives, physician bias, if it's due to gender bias or ethnic or racial minorities, cultural competence that can impact the communication between a physician and patient, a patient-perceived discrimination, and also the patient's decision-making skills, like how much a person is involved in the communication with the physician and manage their own decisions about their own health. So as we mentioned, there are some biological factors that can impact health disparities like genetics and family history, but as we mentioned, only 20% of the impact of health disparities are due to biological factors. But as we mentioned, the majority of the impact is due to behavior and lifestyle, such as smoking, alcohol use, drug use, exercise, our eating habits, and also compliance with medical regimens to control our chronic conditions.
Why is it difficult for some people to change their behavior?
So usually behavior and lifestyle is a personal choice. However, sometimes it is difficult for people to make these choices because it's impacted by social patterns such as socioeconomic status and race and gender, and also other underlying reasons that could harm health behavior like family environment, social environment, stress, and depression and hopelessness. So we call those social determinants of health, which are the circumstances in which people are born, grow up, live, work, and age, and the systems that put in place to deal with illnesses. These circumstances are in turn shaped by a wider set of forces like economics, social policies, and politics.
It seems that the social determinants of health make the cause of health disparities very complicated.
You are correct. So health is a complex equation. So this framework that was developed by the World Health Organization can show us like how the distribution of health and well-being of individuals really complex because they are impacted by many, many factors, such as socioeconomic and political context, like governance, like policy and economic, like culture and social norms that can impact the education and occupation and income of people, and also gender and ethnicity can impact the culture and social norms. And these education, occupation, income factors could also impact the resources that an individual has, their social network, their stress and psychosocial factors, their behavior, and also can impact their biological factor that can also impact their health care they receive. And all these factors interact together that at the end impact the distribution of health and well-being. In another way, Hugh Barton developed this model that called the neighborhood level determinants of health that can show us how the global ecosystem like climate and stability, our natural environment like the clean air and water and land, the built environment like the building, the places, the parks, the streets, safety of streets, green spaces, can impact the activities of individuals, how they work, how they shop, how they move, they live, they play. Also, this impact the local economy of a neighborhood as their wealth and social networks, and this impact on the community, and that impact, lifestyle, and that's where the choices of behavior and lifestyle that impact people. So all these levels are controllable and can be changed, and only the age, sex, and hereditary factors of the individuals that we cannot change, but these are small proportions. So this really model can show us how all these factors and layers can at the end impact a person to make a choice of changing their behavior.
That's very interesting with the individuals, the people in the middle, and then all of those factors around. And it shows the complexity.
It's layers and levels of influences.
Yes.
So these social factors, as we mentioned, can impact education, income and wealth, employment, occupational, access to nutritious food, the housing and living condition, the neighborhood, crime and violence, and the segregated areas, like mothers may not let their children go out and play if the streets are not safe. Also, this can be like social relationships, racism, and social exclusions. People tend to maybe live in more secluded communities if these communities are deprived from resources. So some researchers found that death in the United States, some percentage of death could be attributable to social factors. Like, for example, low education can contribute 9% to death in the United States. Racial segregation can contribute about 6%. Lack of social support, individual level poverty, income inequality, and the neighborhood area poverty also can attribute to death in the United States. And all of that probably are due to poverty.
So how does poverty impact health?
So poverty could impact health. Even parents' income can shape the next generation's level of education, kind of occupation, and their income in their children. So if we look at this framework and take an example of how socioeconomic status and health affect each other over time. For example, if a child is born of low-income parents, this will affect the prenatal care, the postnatal care, and this child may not be as healthy as a child that is born of a well-to-do parents. This also will impact, if the parents are limited in resources, is going to impact the kind of education of their children, what education attainment at a young adult age they will get. And the education, as we said, knowledge and education can impact their behavior and choices of healthy lifestyle. Low education attainment can also impact what kind of job they will get. So if they get like a job with low income, this will impact their health insurance and their hazardous environment in their job that can impact their health. A low-income job will have a low-income retirement. So as they grow and become older, they're going to have limited resources that they will limit their access to quality health. So we can look at to education and how education attainment can impact health knowledge, literacy, coping, problem solving, that could impact the choices of the kind of diet, exercise, or habits of smoking that an individual would be choosing that can impact health. Also, as we mentioned, education attainment can impact what kind of work and work condition and work a person can get, or the income get from this job. That would impact health insurance, if they can leave work if they're sick, or stress. It can impact their stress if the work they do is not safe work. It can impact their income from that job, so it will impact what kind of home they're gonna buy, what neighborhood they're gonna live in, what diet and exercise option, and that would impact health. Also, it can control, the education attainment can control their beliefs, how they cope with problems, social standing, how their social and economic resources in the community, their perceived status, and also it can impact what kind of social network around them that also could impact health.
It's really incredible how complex it is and how many factors can go into that education.
That's why it's not just treatment and prescription of a treatment for a certain disease. There are many, many factors that impacting a person's choices that could lead to health disparities. So for example, this graph can show you that a person with a higher education have a higher life expectancy than a person with low education. This is equal for both men and women. People with less than high school have a lower life expectancy than a person with a college graduate degree.
It's amazing to think about it like that.
And also, not only life expectancy, but some conditions we have. So this is an example for obesity, which is the risk factor for a lot of chronic diseases. You can see for men and women, individuals with a higher degree are less obese than individuals that they have only high school diploma or less. But when we looked at this data, we found that racial and ethnicity does not explain the adult health differences by education. Like for example, for African Americans, Hispanics, Asian, or African and American Indians or white, individuals with higher education have a better health than individuals with lower education. So we can see from this graph, those people with less education, they have more poorer and fair health.
So when we've talked about the effect of education and health, what about income?
So income can shape a lot of options. We all know that. You have more money, you have more things that you could do. So it impacts the choices of the kind of housing you get, the neighborhood that you want to live in, a neighborhood that is more safe, that has more green space, it has more parks. You know too that low-income neighborhoods have more like fast food places than high-income neighborhood. It can impact the diet, access to nutritious diet. Sometimes this diet is more expensive to access fresh fruits and vegetables. Exercise options. Can we go out in the streets and you have park and green space and safe space to exercise? And also, most other factors can be affected by income, like family stability. There are some data shows that low-income families have higher rate of divorce than stable family income, and also some other services for child care and transportation and medical care that can be affected by income. So, for example, income can shape the neighborhood options. As I mentioned, safe place to exercise, access to healthy food, social networks and support, the fear and anxiety and despair, and the quality of the schools in these neighborhoods. Also, racial segregation tracks Blacks and Latinos into poorer neighborhoods than white of similar income. Also, this graph shows that life expectancy in the United States varies by income in a stepwise gradient pattern. And you can see that families with less than 100% of federal poverty level have a lower life expectancy than families that have a higher income level. This is equal both in men and in women. This is a graph from an article that was published this year in JAMA, and they found that there is a life expectancy difference in men and women between low-income women and high-income women, and the same for men. So there is a 10 years difference in life expectancy between low-income women and high-income women, and about 14 years difference of life expectancy between low-income men and higher-income men. So again, when we looked at the difference in adult health by income, we found that racial and ethnicities did not explain this difference. So family with lower income had a worse health status than families with higher income, no matter if they were African Americans, Hispanics, or white.
So we've looked at income, education, and poverty and how that affects health. Why are there health disparities among African Americans and Hispanic Latinos?
Because both race and socioeconomic factors matter. So from this slide, you can see that there are unfortunately higher proportion of African Americans are living below the poverty level. The same for Hispanics, but white have higher level of income. So you can see that there is some structural racial bias that transmits socioeconomic disadvantage across generations, and that's what we call the legacy of discrimination. So lower income, wealth, education, and occupation, and at a given income or education level, African Americans and Latinos on average have less wealth, live in under-resourced, often unhealthier neighborhoods. We're worse off in childhood, as we mentioned, how this can translate in adulthood life. They have more hardship with fewer resources. And also, rarely in our studies, we measure and conclude how racial difference impact socioeconomic and health disparities. But also, we always say that this may be due to genetic factors, not to socioeconomic factors.
Can the racial discrimination harm health in other ways, other than by limiting education, income, and wealth?
So in addition to the limited education and the lower income among our minority groups in the United States, minority groups can experience some overt incidents that could occur that can lead to some stress in their life. And also there's sometimes pervasive subtle incidents that lead to chronic concern about being judged or treated unfairly, like perceived discrimination based on race. Also, discrimination could affect health through pathways involved in stress that could lead to some kind of chronic stress that particularly could be toxic and even absence of any events. And then sometimes even a person internalized racism could harm their health by undermining their self-esteem or sense of control. So for us to address health disparities, we have to understand the role of social factors that we mentioned in this presentation. Like, for example, to address economic and social opportunities, we need some policies to promote economic development, reduce poverty, and reduce racial segregations that we still have in many cities and communities in the United States. Also, we need to look at policies to promote child and youth development and education from infancy through college. And we also need to educate our policymakers to promote healthier homes, neighborhoods, schools, and workplace. And in the same time, these things could lead to better behaviors and better resources for medical care and healthier communities.
So it's a big complex web.
Yes, it's a complex web, but if we know all the causes and factors, we can address one at a time. So we can take charge of the 10% of health disparities due medical care by looking at our medical health system. We can be aware of the 50% of health disparities due behaviors and lifestyle and make the environment suitable for people to make healthier choices. We can advance our basic research to understand that 20% of biological factors and family history that we can address health disparities. And we need to fight the 20%, which I think the most difficult ones, that they are due to socioeconomic factors.
Yes.
Thank you.
That was very interesting. Thank you so much for talking with us about that. And I would like to ask all the viewers, if you have any questions or comments about this, you can email me and I can pass questions on to Dr. Fouad. And thank you for joining us today. Thank you for watching this Health Research Talk. We encourage you to email us with any questions or comments. Also, please take a moment and complete the brief survey on the link on your screen. Let us know what you thought about it and how we can improve it for the future. Lastly, register on the NRMN website to sign up for the online mentoring and be a part of NRMN, the National Research Mentoring Network. Thank you.